Hi guys, welcome back to my YouTube channel. I'm Violet. If you're new here, thank you so much for clicking on this video. I make lifestyle, travel, and med school related content. And if you're a returning subscriber, thank you so much for being loyal, even though I'm so inconsistent. But yeah, today we have an interesting video. I'm here with my friend Ravisa.
Hi guys,
Welcome. So fourth year examinations are coming up. Fourth year med school examinations for med students. If we didn't say that before, you're hearing it now. Fourth year exams are coming up. I think they're writing next week. So we decided we're gonna relive our fourth year OSCE traumas with you guys. Maybe you'll learn something. Maybe you will know what to do better, so you don't mess it up like we did. So yeah, we're just gonna relive all our experiences and share them with you guys. Talk about exams in general, and like just the thought of the timetable alone gave everybody so much anxiety, bro. Do you remember like when we found out how we were writing back to back, like no days in between? That's so intense. But yeah, why don't we start with
nutrition, family medicine. Family medicine, right?
Yeah, but we can't talk about family medicine. This was like what was the first clinical module? Was it surgery?
We wrote surgery.
Surgery, guys.
Hi,
First of all, fourth year surgery is so intense because it's 4 subspecialties in 1 year, bruh. So now you're starting orthopedics, ENT, ophthalmology, and urology. Bruh. It was so deep, and I think they didn't know yet how to make our OSCEs. First we were going to do written, and then they wanted us to do patient-based OSCEs, so it was confusing, man. So we didn't know how to actually really prepare for it. I think the week before, that's when they told us we were going to have Vivers, and then mixed with written station.
And we were the first group.
To do that. It was hectic.
So technically it's like you're studying for 4 modules.
4 modules
in 1 night.
If you're a med student, there's no way you're gonna finish all of that. So basically, many people prioritize. They chose I'm gonna master ortho and ophthalmology. ENT, I'm gonna go gamble. Urology, just God must do His thing there. And that person did. That's what I did. I prioritized ophthalmology and orthopedics. And then ENT, I did small, but I didn't do a lot of ENT because I was willing to gamble with ENT. That's meant for you.
I feel like what came through for me personally was the fact that I did the most during the rotation. Yeah, we rotate for like 4 weeks during the semester. So I tried to master ophthalmology.
Oh, when you were rotating.
Yeah.
I remember we were in quarantine.
Yeah, we were in quarantine.
Imagine, so we already missed some of our surgery rotation.
So I think I gambled on ENT. I decided,
it's fine. That one is okay. But then you know what actually child the urology section? Do you remember what she asked? She asked the weirdest shit, bruh.
Questions?
5 marks each. I think there were 4 or 5 questions. I think I only answered question 1. Everything else I was just like, it's fine, bruh. I don't know. I'm not gonna waste my ink because I don't know.
You need to know the whole urology textbook.
And that's what's so there's no way you're gonna know it.
There's no way. And they're asking something on page what? I don't even know.
Like something you've never seen before, you're seeing it first time in the exam. But I will say this, surgery tips, watch the ophthalmology videos. Literally those videos came through because we were basically online last year because it was COVID. So the guy filmed videos for us in his lectures, and literally everything in those videos is what he asked in the exam. He didn't try to snake you, nothing, just those videos were enough.
Yeah, also ortho, you should do ortho bullets.
Yes.
You know about it?
For sure.
Study ortho bullets, your lecturer slides. They really come through. I think ortho and ophthalmology is doable.
Yes, it's doable.
ENT also, if you go through your slides, it can come through. Urology, I expect anything. I can't.
If you haven't read that book, you throughout the whole year, just go get your fires. Get your fires.
Yeah.
And then, so that was the written. So then the OSCE
was on a Tuesday. And I think, I was crying. After this written paper, I didn't even think I scored the 50 guys. To make it. So I made sure
for your OSCE that you'd be within.
Yeah, because we're the third group,
So we had time to study in the morning. We were so lucky, bro. And then the other group, low-key gave us hints. They were like, for example, if they say we got prostate cancer, then we know we must study like BPH or something like that. And that's exactly what happened. They got prostate CA. No, they got BPH. So we got prostate CA. And then what other station was like? Most of the urology stations were actually fine.
They were doable.
Yeah.
We had also hematuria,
Yes.
like approach to hematuria. We had IVPs,
Yes,
like images.
yeah, there were those weird images that you
stitches.
had to. Yeah, the patient had stitches. You had to interpret those.
Mhm.
But those stations they were manned, like so the doctors were there with you, and they were not as intense as you think they will be. Like, because everybody's scared of that urologist. We're not going to mention her, but if you know what you're doing and you know what you're talking about, there's no need to panic.
Yeah. And I think help each other guys out and just do good.
Yeah.
For us kids, you should study in a
To
group.
grade together.
In a group, like we studied in a group beforehand, and I think when you go there, you remember she put out, oh, Violet was saying this.
Yeah.
Yeah.
Because there's always something someone knows that you don't know. So
Exactly.
and you don't have time to learn it all by yourself. So if you guys go in a group, you'll be within
Exactly.
literally.
Yeah.
All those stations were also fair, I guess.
We had 2 men's stations and we had 3 written.
The written were worse for me than the men for some reason.
Yeah, the way deep. I'm not so deep. I think we had a hip fracture for one.
There was a septic arthritis, I think also. And then a differential for a limping child also is.
Yes,
Yeah.
also that one was in. And then for the 2 men's stations, I got a shoulder examination.
Me too.
And then
So
we
watch
had-
those videos. They will ask you those tests in those videos. Those ortho videos, watch them, please.
Yeah, I know how to examine.
Yeah,
the
because he'll
feet.
ask you what those tests are for the shoulder dislocation, what it is. Yeah.
And then we had an ankle fracture.
And is the Dennis Weber classification. That station was also nice.
Yeah, that one was good.
Ophthalmology, we had to draw the eye. Did you also have to draw the eye?
The
From the optic chiasm all the way like to
The whole
front.
pathway.
Yeah, the whole pathway we had to draw that.
Yeah, and you get like different color pens, so you must use everything.
Yeah,
If you
I
don't know
was
it-
tapping, but if you don't know, you're free because you don't have time because they are time stations.
Yeah, it's time
And
stations.
then the man stations we had one where you had to do like visual equity. I think.
Yeah, visual
Yeah.
acuity, and we had a patient
That one was so nice.
and a patient that had cataracts.
Was it cataracts?
Yeah, I had a patient with cataracts.
Was fundamental.
Yeah, we did visual acuity, and then he asked me like, what do you think is the diagnosis?
Yeah, I don't actually remember the diagnosis, but I know that station was nice because it was so nice.
And the first station was on visual field, so you should know the
Yes, you
defects
should
that
know
you.
those hemianopia, bitemporal, visual loss. Who does know those things? Because they confuse me, man. Because I know how to draw it, and the lady was like, explain. I was like, can't I just draw that? This is the side that's affected.
Yeah, and don't memorize sheet A.
Understand.
Just understand. When you understand
For
it,
sure,
you can
for
find your way, even when you are lost. And take the hints from the doctors, guys. Listen. Look at
The
the
doctors are
eyes.
guiding you during the OSCE. Just listen.
Yeah, exactly. And the other 2 main stations for ophthalmology were, I don't remember, but they were hectic. Yeah.
And
You
ENT.
ENT.
Yeah.
ENT is the images from doctor's slide.
Yes, Dr. Penduka's slides came through.
Yeah.
The one station was literally that slide where he asked all the differentials for neck mass, and he listed them so well in the slide. So we just had to bop.
Yeah. And the next, the written stations were really fair enough.
For ENT,
If you go through all his slides, you'll be good to go.
But it was also, if you know, you know. If you didn't know, there was no way your brain would think of those things.
Exactly.
Yeah, it was very, if you know, you know.
Yeah. So.
But all in all, I think surgery was okay. I think we all
The
expected it to be.
OSCE,
Yeah, the OSCE
was okay, but the written, if you're not serious during the rotation, I don't know if you have.
If you are not God's fave.
I don't know, man. It was hectic. The written was really
Yeah,
bad.
especially for us who did last year in the pandemic, it was really hectic.
And it's like most of us just rotated like for 2 weeks.
Yeah.
Then
You didn't get
quarantine.
your full time. Like I think I was in ophthalmology for 3 days. Literally.
ENT one day.
Imagine.
Corona. And then that's it. So I think that was it for
That was
surgery.
surgery.
Then the next day we
But
wrote
surgery
peds.
did wipe a lot of people out, so be careful.
Be careful. Yeah,
Be
reality.
careful. Yeah.
Mm-hmm.
And then what was next?
It's pediatrics written.
I don't remember Pete's written exam for some reason.
Peds written exam
Yes.
for us because we did okay, fine. We wrote an online test during our first lockdown in March. I think I don't want to say, but doctor repeated some questions from there. Yeah. But okay, for peds, when it comes to pediatrics, you need to sit and read. You need to know.
Because you need to understand.
Yeah. If you understand, okay, I use illustrated and Kubadis, but it's mostly like illustrated. So if you maximize on reading. Then after you've read, revise the text that you have written during the semester. Because like for us, what he did was he repeated the last kids group. Their written tests. That's what he repeated it, and he took some from the written that we did online. So
I know personally for PEDS, those IMMS tutorials came through for me because I basically we never rotated in PEDS. We were in quarantine. We were in PEDS for like 2 days and then we striked. Yeah, last year was a lot, so I basically never rotated in pediatrics. The last time I was there was 3rd year. So IMMS tutorial, Israel tutorial came through. I invested, I paid for their tasks, and it paid off because that's all I did. And now our lecture slides, and I don't have time for textbooks. For PEDS, I didn't have time for textbooks. So I did lecture slides and Izzy and IMMS notes. That's all.
Shout out to IMMS and
they
Izzy, guys.
Our academic year, you guys. Yo.
Yeah. So
even the PEDS OSCE was really fair. He really asked cases we've done before, because even online, when we're doing online, he would give us those exams, case
the assignments,
and some of those cases were from there, so everything was familiar. There was nothing like, where is this coming from?
And then for the OSCEs, we had 5 stations. So the first station, I think we had a sickle cell disease.
I don't remember these.
We had a meningitis also, and then we had a kid with congenital adrenal. Was it the CAH?
Congenital
adrenal hyperplasia.
Why am I not remembering the content, bruh?
Girl, you know. And then we had did I mention the meningitis already? Yeah.
There was one of those congenital diseases. Is it Turner's?
Turner's
one of
PEDS is a doable module if you're serious.
But it can also wipe you out.
But it'll wipe you out fast also. So please read.
Who goes out during exam? I accept another day. Anyways, so we're continuing from, that was PEDS. And after PEDS we took gynae. We had the weekend, then we had gynae.
On Monday.
4th year you only do gynae, you don't do obstetrics, because you do obstetrics in 3rd year. So gynae in general, I think gynae is very straightforward.
Just like, I think you get seminar topics during your semester.
Yes.
You get a table with the topics that you need to cover, about 22 chapters, I think. Read those.
Read them. Read the doctor's updated slides. Like, those people, they make effort to make the seminar like as up to date as possible. So use their shiny. I don't know JNA, but that brown textbook is outdated.
It's outdated, but it's good. I love the brown textbook when it comes to pathophysiology.
Maybe to understanding the condition.
But when it comes to management, I'll go back to what the doctors have told us now.
What the doctors are saying, what up to date, what new guidelines are saying.
Exactly.
Personally, gynae, Toronto notes, that's what I use, and WITS gynecology. That's all I use for gynae.
Technically, I think that's it.
Especially management, who go read in WITS gynecology. Toronto notes, if you don't have time to go study the whole disease and its whole life story. Toronto
and
notes.
your slides,
What was in the exam?
We had STIs.
Molar pregnancy?
We had STIs.
The matching was that semen analysis,
Semen analysis. We had, you guys know the anatomy of the uterus. Matching on anatomy, what runs in the suspensory ligament. I remember the answer was ovarian artery. And then we had cervical. We also mentioned cervical CA, like management of management. If you do a simple hysterectomy or radical, I think on Tuesday we had the OSCE now. That's good, guys.
Gynae is a First of all, Ravisa is a fucking juju, because everything that this D told us to revise was asked.
Literally.
Like, you know, there are some people who just have that intuition about what will come in. Ravisa has been that person, bruh. Literally. Remember that morning we were in my room and you were like, we're going through these topics, and literally those topics came in.
So what I do before in OSCE, I always like make a list. I always write maybe like gynecology OSCE. Then I always write a list of topics that are most likely to come in. And I always know among those 10 topics I wrote,
it's there. The exam is from there.
The exam is there.
Literally.
So everything that basically was on my paper was what came in.
I remember, bro.
Literally, we started with an anatomy station. Then we had the instruments.
Instruments are always in.
We had an ectopic pregnancy. We had the ovarian cysts.
Yes, for the variances. I'm not remembering ectopic in the anatomy station.
Remember?
Wasn't it PCOS or something also? Something that we went through outside.
PCOS was also in.
Yeah.
Urinary incontinence was also in. Because you get 10 things. And then we had molar pregnancy was also in.
Molar.
Yes. And miscarriages. We got.
Miscarriages already.
No, the ultrasounds of miscarriages, eh? Because we just got images. And then they're like, what do you think is happening? Yeah, and there were various cysts, because they say, remember, you should know the ultrasound of which one is benign and which one is malignant.
Yes,
Know the
yes,
features.
Yes, literally. I think I remember that station.
That was our last station. Yeah.
All
in all,
a gynae is fair. Gynae is fair. Don't stress about gynae.
don't stress about it. Yeah. It's a good one.
It's a good one. And then we went to the
I hope I don't cry, guys.
the most traumatizing modules of my life, bro. What? Internal medicine.
What was it?